and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Exposure to anti-seizure medication in utero may lead to neurodevelopmental risks in children. Children born to mothers who take anti-seizure medications to manage seizures and psychiatric conditions during pregnancy may face increased risk of neurodevelopmental conditions, according to a new data from researchers at Drexel's Dornsife School of Public Health. The findings were published in the Journal of Nature Communications. The current work, using data from more than 3 million children from the United Kingdom and Sweden, including 17,495 who were exposed to anti-seizure medications during pregnancy, found that children exposed to the anti-seizure drug lamotrigine in utero were at no additional risk for autism or intellectual disability compared with those exposed to other anti-seizure medications. However, children exposed to valproate, topiramate and carbamazepine were linked to specific neurodevelopmental issues. However, the absolute risk of neurodevelopmental outcomes in offsprings is low, the researchers caution, regardless of anti-seizure drug regimen. Compared to children unexposed to anti-seizure medications, those exposed to the drug topiramate during pregnancy were 2.5 times more likely to be diagnosed with intellectual disability, which raises their risk to 2.1% by age 12. In comparison with other drugs available, the authors found very little data suggesting that the drug lamotrigine in pregnancy increases the risk of neurodevelopmental issues in offsprings. Study in Nature to reduce emotional distress. A new study found that spending 2 hours a week of class time in a natural environment can reduce emotional distress among 10 to 12-year-olds who had the most significant mental health problems before the program began. The research comes on the heels of the publication of a UNICEF report pointing to the importance of green space for children's development. The study, published this week in JAMA Network Open, looked at the effects of spending time in nature on the behavior and mental health symptoms of over 500 school children across Quebec in the spring of 2023. The researchers found that at the end of 3-month period, teachers noted that the biggest changes in behavior occurred in children with the most significant problems at the outset, including anxiety and depression, aggressivity and impulsivity, or social problems relating to interaction with their peers. Interviews with the teachers following the intervention also suggested that children were more calm, relaxed and attentive in class after time spent in nature. The research builds on earlier observational studies but is the first to use a randomized controlled trial to provide concrete information about the benefits to children of spending time in nature. Sitting more than 10 hours may put heart health at risk. More time spent sitting, reclining or lying down during the day may increase the risk of cardiovascular disease and death, according to a study in JACC, the flagship journal of the American College of Cardiology, and presented at the American Heart Association Scientific Session 2024. More than roughly 10.5 hours of sedentary behavior per day was significantly linked with future heart failure and cardiovascular death, even among people meeting recommended levels of exercise. Our findings support cutting back on sedentary time to reduce cardiovascular risk, with 10.6 hours a day marking a potentially key threshold tied to higher heart failure and cardiovascular mortality, said Shan Khurshid, MD, MPH, a cardiologist at the Massachusetts General Hospital and co-senior author of the study. Too much sitting or lying down can be harmful for heart health, even for those who are active. The study examined the amount of sedentary time at which cardiovascular disease risk is greatest and explored how sedentary behavior and physical activity together impact the chances of atrial fibrillation, heart failure, myocardial infarction, and cardiovascular mortality. Can heart shape predict risk for cardiovascular diseases? A new multinational study has revealed that the shape of the heart is influenced in part by genetics and may help predict the risk of cardiovascular diseases. Researchers are forced to examine the genetic basis of the heart's left and right ventricles using advanced 3D imaging and machine learning. By studying both ventricles together, the team was able to capture the more intricate, multidimensional aspects of the heart shape. This new approach of exploring shape has led to the discovery of new heart-associated genes and provided a better understanding of the biological pathways linking heart shape to cardiovascular disease. Genetic information related to heart shape can provide a risk score for heart disease, offering potentially early and more tailored assessment in clinical settings. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.